Did you know your liver could be quietly struggling while showing no symptoms at all? Fatty liver disease is becoming one of the most common and silent threats to our health. What if I told you that, with just a few lifestyle tweaks, you could reverse it before it reaches a point of no return? Stick with me, because we're about to uncover everything you need to know about fatty liver disease, its stages, symptoms, and, most importantly, how to stop it in its tracks before it's too late.
Hey everyone, welcome back to my channel NutriNook. In this channel, we talk about various health-related topics that will concern you if you want to live a healthy life. So keep watching our videos. And also, a request to please subscribe to our channel for more health-related future videos.
Fatty liver occurs when excess fat builds up in the liver. Having a small amount of fat in the liver is normal, but too much can impair its function and lead to health complications. Focus of this discussion: non-alcoholic fatty liver disease, NAFLD, and the progression of the disease through 4 stages. Stage 1. Simple fatty liver or steatosis. Excess fat builds up in the liver, but there's no inflammation yet. At this stage, it's reversible and often shows no symptoms. Stage 2. Steatohepatitis. Fat buildup is now accompanied by inflammation in the liver. This is a critical turning point that requires immediate action. Stage 3. Fibrosis. Persistent inflammation leads to scarring, though liver function is still intact. Reversal is still possible with the right treatment and lifestyle changes. Stage 4. Cirrhosis. Widespread scarring severely damages liver function. At this stage, the condition is irreversible and can lead to life-threatening complications. While early stages may be asymptomatic, as the disease progresses, symptoms may include abdominal pain and nausea, jaundice, yellow skin and eyes, weakness, fatigue and weight loss, dark urine and pale stools, swelling in the legs or abdomen, which is known as edema or ascites, easy bruising or bleeding, spider-like blood vessels under the skin, breast enlargement in men, and confusion and memory issues in advanced stages. So, here's a tip for you. Pay attention to your body. Many of these symptoms overlap with other conditions, so regular checkups are crucial. Good news, up to stage 3, fatty liver is reversible. Here's how. 1. Weight loss. Excess weight is one of the leading causes of NAFLD. Aim for a gradual weight loss of at least 10% to improve liver health. 2. Avoid alcohol. Alcohol accelerates liver damage, even in small amounts. Eliminating it entirely is key for reversing fatty liver. 3. Diet tips. Mediterranean diet. Focus on olive oil, fish, whole grains, and fresh fruits and vegetables. This diet helps reduce inflammation and fat accumulation in the liver. Boost potassium levels. Eat bananas, kiwi, and sweet potatoes to support liver function. Choline-rich foods. Include eggs, chicken, and soybeans to reduce fat deposits in the liver. 4. Supplements and nutrients. Vitamin E, a powerful antioxidant that reduces liver inflammation. Vitamin D supports liver health and slows disease progression. Coffee? Surprisingly, 3 cups a day can help reduce fatty liver symptoms due to its anti-inflammatory properties. 5. Exercise regularly. Aerobic exercises like running and swimming, as well as strength training like weightlifting, are highly effective in reducing fat deposits in the liver. You've now unlocked the secrets to identifying, preventing, and even reversing fatty liver disease. But here's the thing. This knowledge is only powerful if you act on it. Start today by evaluating your lifestyle and take 1 step at a time. Share this video with someone who needs to hear this message, because together we can fight fatty liver disease one healthy choice at a time. Stay curious, stay healthy, and I'll see you in the next video of How Food Industry is Controlled by Mafia.